last video, we just talked about the different concerns you could have with skin and then figuring out what bothers you, if anything, and then that can help guide what you do or don't do or look into, okay? So one of the things we mentioned was wrinkles. My other little bony gal, I called her Sally, so I had a name for her, but I forgot. So let's call her Frally, okay? These are muscles of the face, okay? She's missing the mentalis muscles, which are the chin muscles right here. Appears like I dropped them and couldn't find them. So Frally's been without that for a while. But I think this visualization will help when we talk about Botox. So how Botox works, and when I say Botox, I mean any aesthetic neuromodulator on the market, okay? There are quite a few now. So there's Botox, Jeuveau, like Tebow, Dysport, Xeomin. There are a bunch, and there are more coming, okay? But we don't need to get down the rabbit hole of that, of which one and the small differences between them. Let's just talk about how the toxins or tox works, okay? So we have two types of wrinkles on our face. We have dynamic and we have static wrinkles. Static wrinkles are caused by free radical damage, sun damage, and static wrinkles are the ones where if you're not moving, you see them at rest. In Colorado, you'll often notice them here. I mean, you can notice them anywhere on the face. The cool thing about wrinkles is that the wrinkles always run perpendicular to the muscle fibers, okay? I mean, I don't know if that's cool to you. That's like super cool to me. So, static wrinkles you see at rest. Tox is not the best for those. It's like you kind of already got the toothpaste out of the tube. It's very hard to get it back in, okay? If you have dynamic wrinkles, that's our other type of wrinkles. Those are the ones where you mostly just see when you're moving. Again, I just had Botox, so I'm not really moving. But if you raise up your eyebrows, you'll see horizontal lines. If you make a mad face, you'll see 11s or vertical lines here. Those are dynamic wrinkles. When's the best time to start tox treatments? Well, if your wrinkles bother you. Normally, I'll tell people if you're noticing your makeup settling in like horizontal lines on your forehead, if that bothers you, it's a good time to start tox before those dynamic lines they're like starting to get static, before they get really set, okay? If they don't bother you, forget about it. Don't even worry about it. So static and dynamic wrinkles. Dynamic are the ones you see with movement. Tox works way better on dynamic wrinkles. If you have static wrinkles, that is something like you might see improvement with multiple, remember 6 or more microneedlings. Upper lip lines, those I would call dynamic, okay? They can be static too, but we're moving it all the time. So let's talk about the forehead, okay? Because that's a big concern. So the forehead muscles right here, it's called the frontalis muscle. If you notice, I think you can see hopefully, the muscle fibers are vertical, which means the wrinkles are going to be horizontal. Remember, the wrinkles are perpendicular to the muscle fibers. So if you have a vertical line, I'm sorry, not a vertical, a diagonal line from here to here, it's not from a muscle. That is a sleep line, okay? It's from sleeping on your side and squishing it up. Sorry, nothing I can do about it. I mean, I can microneedle it, but it is what it is. That is not from muscle movement. Sometimes people don't notice that until after they have Botox that relaxes the horizontal lines, and they're like, this wasn't there before. It was, it's just you didn't notice because the other lines are bothering you more, okay? So the frontalis muscle has vertical muscle fibers. It causes the horizontal lines on your forehead. Every muscle has a purpose, a functional purpose. The purpose of the frontalis muscle or the forehead muscle is to raise the eyebrows up, okay? It can evoke a sense of surprise and other things, but basically it raises your eyebrows up, okay? Wherever we put tox, the muscle cannot do what it was designed to do. That is the purpose, okay? How all the toxins work is normally for a muscle to contract, it has to get a signal of a release of a chemical called acetylcholine. And the acetylcholine says, hey, muscle, go ahead and do your thing, like contract, move in the way you want to, okay? When we inject tox, the muscle does not get the signal because there's no release of acetylcholine, okay? That's how it works. It prevents the release of acetylcholine. So it's not really like freezing your muscles per se. It's more just like, they're like a teenager who doesn't want to listen. They're like, I'm not going to do that, okay? They don't get the signal. They like do not hear it to contract. Toxin, you inject it, okay? And then it takes 2 full weeks to kick in. I love a bell curve. I'm going to be talking a whole lot about bell curves, okay? So you don't do any adjustments in that 2 weeks, okay? Ask me. I've been doing this almost 10 years. I thought I was doing patients a service in the beginning when I would do a little tweak before 2 weeks, and almost always I would cause a problem because it wasn't kicked in yet. You have to wait till it's kicked in to know what it's going to do, okay? So no adjustments till 2 weeks. Then we only do adjustments between 2 and 3 weeks, and I'll tell you why. Toxin kicks in at 2 weeks fully, right? And then it's at its best. It's at its best between like around 6 weeks. And then you're at the top of the bell curve and you're gonna start going down. That means you're gonna start getting more muscle movement. That does not mean it didn't work for you. That's how it's supposed to work, okay? It's like the little signals of acetylcholine release are like coming back, like a little acetylcholine comes. So you're gonna notice some more movement. If you haven't had a lot of movement, it's gonna feel drastic, but that's why it's important. Take a picture and a video of yourself on your phone so you can compare. We are the worst judge of ourselves, the worst, me included. It's this thing called perception drift, and it's where you just don't see yourself where you are and where you were. It's like how you don't notice your kids getting bigger till you see a picture and you're like, oh my God, time's flying. So it's supposed to work that way. 2 weeks to kick in. At week 6, it's at its best, and then it starts to taper off. About 12 weeks is the soonest. 90 days is the soonest you want to get re-injected, okay? Even for a different area. Keep it at 90 days. Another thing I used to do is inject, because budget is like a real thing, right? People wanted their eyes and their forehead and frown lines. Couldn't afford it all at once. So I was like, okay, let's do your forehead and frown lines this time. Come back in a month, we'll do your eyes. It was not in the patient's best interest. I thought it was at the time, because your forehead is kicking in and then it starts to wear off, and then your eyes are kicking in and it starts to wear off. And then they're kicking in and wearing off at different times, and it just looks not wonderful. It's like your muscles should all work together, okay? So it'd be much better just to leave your eyes off for Botox one treatment and do it every 6 months, or do it once a year and treat it fully. Don't skimp on the dosing, which we'll talk about. So the forehead muscle raises up, okay? Number of units is not the number. Units are like an arbitrary measurement these companies have come up with, and the units from product to product are different. So don't worry so much about the units in that, like 20 units for the forehead does not mean 20 injections. Usually each injection, this is not for Dysport, but for most of them, are like 2 to 4 units per injection. Okay, so the typical forehead has 5 baby pokes with a teeny tiny needle. You don't necessarily need 20 units, but it is fact. Like, I'm not a wizard. I'm really good at what I do, but science is science, okay? 20 units, we know, will get most people 3 to 4 month duration. So you could, of the bell curve, you're still gonna get movement. It does not mean you're frozen or no movement until 3 months out. It just means it's gonna kick in, you're gonna have the muscles relax, not be able to do what they wanna do, and then they slowly come back to life and get perky, okay? If you go lighter than that, it's not gonna last as long. That is the science of it. That's fine, right? Like if you have somebody with a really strong forehead muscle is going to need more than somebody who doesn't move their forehead a lot. I have like a two-head, like a really short forehead. I may not need as much as somebody who has like a forehead that's 4 fingers. Everybody is unique. okay? And it is a little bit of a guessing game at first because I could have two people could have twins, with the exact same forehead size. I feel their muscles are pretty similar, inject the same number of units. Twin A may need more units, twin B may feel a little heavy. It's a little bit of a guessing game. That's why it's important to come back the first time after you get tox at the 2-week for check-in. So why wouldn't you just do 20 units in the forehead then for everybody so you can get the duration and smoothness? Because I'm glad you asked. Remember, where I put tox, the muscle can't do what it wants to do. So the muscle on the forehead, the frontalis muscle, raises the eyebrows. I have a lot, I shouldn't say a lot for me. I have 16 units in my forehead right now. So I cannot raise my eyebrows. I'm fine with that because I like how it looks. If I had a lot of upper eyelid skin, I would be real ticked right now. And what women will say is when they're putting on makeup in the morning, they have to go like this to lift their eyebrow. Because I have completely relaxed my muscles on the frontalis, they cannot raise. They will start to in about 4 weeks, a teeny tiny little bit, but we just have to like balance it. Do the lines bother you more? Because I can get rid of your dynamic lines. Or do you want a lift? You have to choose, okay? It's which one's more important. Again, it's how the science works. If you want lift, then you get lift by letting the muscle move. I cannot let the muscle move and you not have wrinkles. It's just like, sorry, that's not, take it up with the creator. That's not how we're made, okay? Some people, their frontalis muscles are really strong right here. They're like little stacked commas. So if you raise up your eyebrows, mine are like this. And you feel a lot of movement out here, or like if you can do kind of like a rock eyebrow, chances are, you're not going to love tox if you have any sort of heavy upper eyelid skin. Because if I get rid of the wrinkle, which I can, just push right here and try to raise your brow. You can't. So I can soften the wrinkle with like placement and the dosing, doing it really conservatively. However, remember the dose is the duration. It's not going to last. Okay, so that's really important to talk about if you're doing tox with your injector. Do the wrinkles bother you more or do you want maximal lift? There's no right or wrong answer and you can change your mind each treatment. Or if you're like, yeah, I just don't want any lines on my face, then that may be what you think, and then it kicks in and you're like, I hate how this feels, because it just feels weird. It kind of feels like the first time you are moving through, I've never been in quicksand, but what I imagine quicksand feels like just very difficult to kind of like, takes a lot of energy. Raise your eyebrows up if you can at all. So then we know, okay? The great thing about tox is it wears off. It always wears off, but you cannot reverse it. So sometimes what happens when people come back, we all have one brow that's stronger than the other. My left brow is stronger. So what happens is the left brow wants to have a party, and then the right brow is like, I don't want to go to the party. And then with tox, it can just accentuate it if you don't know the placement of it. So sometimes people will come back and they're like, I want the right brow to look like the left brow after 2 weeks of their tox injection, and I want that for you. But righty's never gonna come to the party. Righty's never gonna be an extrovert and stay out all night and be like excitable. It's just not. They're not twins. They need to look cohesive together. I mean, you don't want to be like Tim Allen in that movie. I forget what it was, but with the crazy brows. It's a Santa movie. Anyways, usually if one brow is really flat, we can't raise it to match the other brow. So what we can do is lower the lefty a little bit, or sometimes if you feel muscle movement up here, you can inject a little tox here, and then that will force this up a hair. And by hair, I mean like a millimeter. It is not like half an inch, okay? I wish. It's just not the science of it. So that's the forehead. That, in my opinion, is the hardest spot to nail on patients because I do too. I want the best of both worlds. Like if I could be this smooth but raise my eyebrows, heck yeah, that's what I'm going for. But it doesn't work that way, okay? So when you treat the frontalis muscle, you have to treat the glabellar complex. The glabella is not really a muscle. I don't know why we call it that. It's made of two different muscles. So you have the procerus here and you have the corrugators here. The frontalis is an elevator. It raises up. The glabella is a depressor. It pulls down and in. Okay, so it creates the 11 lines, or like the vertical. Sometimes people have a 1. If you don't, like, normally people have either more dynamic wrinkles in their forehead or their glabella. Often they don't have both, and they're like, oh, I don't want Botox in both. Why do I need it? If you do the forehead, you have to do the glabella, because if you don't, whatever muscle is adjacent to or nearby the muscle you injected with Botox wants to work harder, okay? So if I have relaxed the frontalis muscle so it can't lift, my face is going to try to move. And what it wants to do is pucker up and do that angry face, and this muscle will get hyperactive, the opposite of what we want. And from the side, it will look like a caveman. It's really not cute, okay? So if you treat the forehead, the frontalis, you gotta treat the 11s. And to me, there's no point in not treating it, because all the 11s, do you remember where you put tox, the muscle can't do what it wants to do. The 11s muscle, the glabella, it wants to pull down and in. So it pulls like this, like who wants an RBF? And who wants like a heavy medial brow? Not me. So all it's gonna do is lift up the middle of your eyebrow, make you look more awake and alert. Lovely. Typical dosing there is 20 units. And I really don't find sometimes people need more, but I really don't typically do less than that, because the dose is the duration, and it really softens people's appearance and they look like them. If you're like, yeah, my 11s really bother me, but my forehead doesn't, you can treat, if you want maximal lift, you treat the glabella, you treat the 11s, 5 injection points, okay? And you leave off the whole forehead. That will give you the most lift of your eyebrows. If you're like, I don't want the eyelid surgery to get rid of my upper skin, don't care about my wrinkles, I just want to like be able to see, my eyes get so heavy, you can just do the 11s in here and leave off the forehead. Remember, wherever you don't treat, it wants to work harder. So you'll get more lift on the forehead, which means your brows will go up even higher. If you don't treat the forehead though, you're gonna have the horizontal lines, which is fine, but that's an option.